Hi, good evening and welcome to the IBD Ostomy Support Show. I'm Louise, aka Crohn's Fighting, and we're back. So I think we've been off for a month, surgeries, just people not well, life in general. So yeah, we're back. Tonight we will be discussing mine and Steve's operations and the recovery process. So be warned, it might not make for pleasant viewing. We've all had our own individual sets of issues. So what have I been up to? Well, I've had me butt glue closed. I swear to God, I've still got glue wedged up there somewhere. But I'm still not allowed to have a bath until I've had the all clear from the surgeon. As to when that's going to happen, who knows? I've had the appointment for the dietitian, no appointment for the surgeon, and I was supposed to be seen 6 weeks after discharge, but I think I've got another 2 weeks yet. So yeah, we'll deal with that when it comes to it. I've had to get my pain meds changed from oxycodone back to codeine because I was tripping off my nut taking oxy. I thought the fan next to me bed was a seagull nest. And then following the night and the morning after that, I thought I was being dive bombed by seagulls in bed. So I quickly got that changed. I am not good. It's in the cupboard now. It's put away in the cupboard, and it's for anybody that's got like, you know, really bad tooth pain or done their back and saying, "Here, I've got something for you, take a couple." I'm not promoting giving out your pain meds, but anybody within the IBD community and everything else knows what we're like. I've got frequent chats with James and other people with regards to passing out meds and passing. If you don't want to try that, give those about, it'll be all right. So yeah, I have just actually been doing as I'm told and resting. I started back driving this week once I had it cleared from the insurance company because I was starting back a week early. I wasn't allowed to start driving, and technically not allowed to start driving until next week. But my insurance company said as long as I feel safe and that I've got no pain with regards to an emergency stop, then I'm absolutely fine to drive. I had an appointment with my stoma nurse today, going from a loop stoma to a end stoma is a bit difficult to wrap my head around, in all fairness. I've been so used to having something that I can literally spout and place into the bag, whereas now I'm trying to push it out and get it into the bag with convex, which isn't great. My stitches were left in, so I ended up with granulation tissue again and having to have the stomas dug out 21 days post-op. So that wasn't fun. It took another 2 weeks for my stoma site to heal completely after. And yeah, I'm back to see the stoma nurse in the new year. So we'll see what happens, because I got told off today because I use a barrier cream and a barrier ring, and I'm not allowed to use both apparently. And I said, well, it works for me, so left it at that. And yeah, that's about it. I'll be back, obviously, a bit more about dates in a bit. I'm just going to go back onto the chat and I'll pass you over to Rachel.
Thanks, Louise. Hi, I'm Rachel, aka Rockin' Two Stomas. I just want to say welcome to the Barbie and Ken Butt Club, Louise and Steve. Natalie, we're now in the minority. We're like, and I know it can never happen for me, so I'm like always never going to be there. But there we go. But yeah, welcome to the club. It was hard and interesting and not very nice being on the other side. Yeah. So what have I been up to? A lot. It feels like it's been a really long time since we've been on the show. I think it's been a good 5 weeks, 6 weeks.
Oh,
for me,
wasn't it? It was the 18th of October last show.
Was it? So it's quite a while. It's really good to be back on, and I feel like I have missed it. And I was seeing everybody. It's like, yeah, it's nice. So what have I been up to? I got a phone call yesterday to ask if I can. I was doing a poster at the Bourne, which is a British nurses conference, and I've asked to do a presentation. So I've spent the last few, probably yesterday, panicking, but I'm going to use the same presentation I used at the ASCN. But I'm really excited because the urostomy awareness research has gone down really well, and it seems to be that we are hoping to present at some international conferences next year. So I think it's all positive. It's just I've had a lot on, and I don't think I've really stopped, and more seems to be coming out of the woodwork. And I'm just kind of trying to take a breather. And the whole thing, I struggle with the balance, and I always have. And I feel like I constantly say this every week, that I'm working too hard and I don't really spend time to rest. I still can't watch a film all the way through, something I need to work on. I should have changed my pouch before because it's really itchy. It's really, when it's itchy, thinking, oh no, I should have changed it before I came on.
That was me last night laying in bed.
Was it?
Yeah, 2 o'clock this morning. It's getting a bit itchy. That's right, since stoma nurse at 11.
Mine just lasts for such a long time. My urostomy, if I'm not careful, it lasts like more than 7 days. I literally like leave it to be and it works well. And I'm like, oh, it's been like 7, maybe 8 days really to change it. So I'm trying to like change it more, but because I don't want to get the I don't know if kidney infections are, they said that it isn't relatable with how much you change it, but yeah, so it's something I need to pay attention to. For some reason I can't get the chat to work, so the chat's up but I can't reply. So I'll work that out for next week. But yeah, it's great to be on, and I think have I got anything else to cover? Oh, just thinking of everybody in hospital, and I can't remember names, but there's quite a few people at the moment. Quite a lot of people have had surgery. I know Lydia's just had surgery, hasn't she? Barbie Butt Club. Welcome.
Oh, she made me laugh. I think she posted up on Instagram today that obviously she's a bit doped up, and obviously day 3 and she's still got a clicker button. It's in pain. Man, it's pain. Yeah, that is painful. There's no telling lies about that one, I can tell you.
I laughed because I thought, oh, it's the same picture Louise had with her bunny. I was like, Steve was missing his bunny.
I haven't got a bunny.
You got my bear, my stoma bunny.
I've got my own stoma bear, actually, haven't I?
Well, I'll pass you to Natalie.
Hi, good evening. Natalie, the Spoonie Mummy. Well, I have been a busy bee. I've my Crohn's has been pretty quiet. My arthritis has had a bit of a do since having my flu jab. If you follow me on Instagram, you'd have seen me popping on to update. I think just the inflammatory, the kick it gave to my immune system kicked off my inflammation, and my knees were just massive and sore and stiff and that for a few days. But they've calmed down a lot now, but it's been my eyes that have been playing me up. I had to go and have eye laser, well, it was plastic surgery, but I was awake and all that. Was it 2 or 3 weeks ago now? 3 weeks ago, I think, to relieve the pressure again in this eye, because it's still not been fixed from the operation I had in Southend that went wrong. There's a whole long story, but basically they put the lens in wrong and it's covering some of the drainage ports, so the pressure builds up, and that can cause issues with your vision and stuff if the pressure's too high for too long. So he had to get it down pretty quickly and did lasers, and oh my god, the pain was immense. But I went back the following week and he said the torture was worth it. My pressure's back down. So now I'm just waiting to see him for follow-up again in December. And I'll be back with, I'm going to go see the glaucoma guy as well in December. Not that I've got glaucoma, but because it's an issue with pressure, he just wants his input on sort of where we go long term. I've been damaging myself. I've managed to, it's half hanging off again. It's just such an awkward place to dress. But a couple of nights ago, I was washing up and I managed to take a massive chunk out of my hand.
Oh, no.
I've never seen, obviously, because my hands were warm, because they're in the water, it bled even more. But loads of people are like, you need to go to hospital, you need to go to hospital. But because of where it is, they couldn't stitch it anyway, because it's right on the edge of my hand. So I've been like, redressing it, cleaning it, redressing it every morning and every evening, but it's just, like I say, because of where it is as well, it's just so awkward and it's peeling off now. But I'm going to change this again before bed.
Do you not remember when I had the accident with the Belgian beer glass last year and I went to the chemist and steri-stripped it up because I couldn't be bothered to go up to A&E?
Well, that's what somebody said to me. They were like, just go and buy steri-strips, but I've been putting like quite a tight sort of dressing on it.
You're better off putting steri-strips on it and letting the air get to it and just dress it if you're doing anything mucky.
And that would probably be easier, to be honest, anyway. But it hadn't stopped bleeding.
No, because I did. I think you've done it in exactly the same place as I had, because mine was on the corner of the finger. Yeah,
really, really sore. But this morning I woke up, felt wet and thought I'd leaked. So your hand automatically like shoots down, doesn't it?
Yeah.
And I was like, okay, my bag's not leaking. And then I realised this had come off and it was bleeding again everywhere. So I was like, oh, so I was up at 5 o'clock, not to change my bag, but to sort my hand out again.
Oh, sure.
But yeah, other than that, it's just been a lot of stuff. Steve's been in hospital as well, which hasn't helped. Luckily, he's all sorted now, but it's just like one thing after another. And mentally, I think I've struggled more the past few weeks than anything else. I'm back at uni and I was loving my courses, loving it, starting them. But this last week or so has just been so hard to concentrate and to get anything to sink in. And I've got assignments due next week, so my head's just like, but yeah, we'll get there. Christmas is coming, so I'm looking forward to that. And
I think we've all been there. I know I've just I've been started back at work, so I've been proofreading and stuff, and I've been sitting there for an hour and rereading the same thing and going, you know, when you just can't concentrate.
Natalie, I'm similar as well. I've got four articles I've got to write for medical journals, and I'm just procrastinating because I just think I'm not good enough. And I've started one, and I'm just thinking, oh, the deadline's now creeping up. I really must do it. So I completely get it, and it never goes away. It's constantly there going, I really need to do this. I really need to do this, and I can't actually rest.
That's the perfectionist that is, though, because you know you've proved time and time again that you are good enough. It's just you battling yourself, that is. So don't worry about it. Get on with it. You know what I mean? Procrastination is just another word for can't be asked. Nah, I'm only joking.
Thanks,
no, honestly, you know, you're always gonna fight yourself, and you're gonna want the best thing out there, aren't you? You're gonna want to get it perfect, and time and time again, you know, you can do it. It's just about believing in it. You know what I mean?
Just to add, I think every single one of us now has our wings from PW.
Yeah, we do, don't we?
Yeah, that's true.
We'll talk about that. We'll let Steve do his little bit, because poor Steve, he's always the last one to go.
Always the last to know.
Best till last, Steve. Lovely. Best till last.
Hashtag Baghdadi. What have I been doing? Well, I've had my bum hole removed. That was interesting.
What do you call it, Steve? What do you call it?
Well, firstly, I want to thank Rachel for being there, because you know what? I wasn't the best patient in the world. I don't like hospitals at the best of time, but Rachel's been an absolute star. She's looked after me and stood by me. So that's, you know, massive props to Rachel. I had my peristomal hernia repaired, which, to be honest, my rectum removal went like a dream. They didn't even check me in the hospital for about 4 days. I had to say to one of the nurses, you know, could you check my bum? Because nobody's looked at it, you know, nobody at all. And she went, yeah, no problem. So everything's gone really well there. But my tummy was a different issue. Once the staples were removed, I found out that I was allergic to the staples. So I just looked like I had snake bites right down my tummy. A couple of areas opened up. I was full of drains. I had 5 drains and a catheter as well, which wasn't the best. I looked like one of them. Looked like Just Married. You know the Just Married bit with all the cans dangling after the car.
Steve, sorry. Obviously, why did you have so many drains? Just out of curiosity, because obviously when Rachel told me how many drains you had, I was like, how many?
One was in the buttock. One was in the buttocks to drain that operation, and 2 were either side of my because I've had pig mesh put in my hernia, so 2 were either side. That coupled with the catheter as well, it was just ridiculous. I remember the second day they got me out of bed, the physio, and they said they got me having walkabout, sat in the chair, and then I thought, right, I'm going to have a walkabout myself now. They've gone, and I thought, and I'm grabbing all my cans, all my bottles, I'm hooking them to my Zimmer frame, and then and off I've gone, and I've walked like 2 steps, and the hanger with the intravenous fluid on, that nearly fell over, so I'm stuck there like the Krypton factor. I didn't know which way to turn. There's wires everywhere. It's ridiculous. It took me like an hour and a half to get all my sort of bottles hooked up, because I was quite confused because of all the morphine. But and so in the end I just sat there. But it was really quite a difficult recovery from the stomach operation. Obviously I've had a new stoma formed, which, you know, we're not best of mates just yet, but we're getting there. And I think I was only expecting like a week in hospital, but it was turned into 12 days, so it wasn't the best best time.
Yeah, I think I was out the day. I think I come out a day before you. I think I was in 10, or was I in 10 or 11 days? I can't really remember. But you know, your drain. You said you had one in your buttocks. Did you know they put mine right? Mine didn't get removed for 4 days. I think it was the one from the butt. My abdominal one stayed in a lot longer because of the post-op ileus and everything else. But it was right between my butt cheeks. So trying to sit down, trying to get the wire and trying to get the drain round, and then try and sit yourself down without catching it. Oh my God!
I can't even tell you where it was. You know, I just know that I was told it's in my buttocks.
I know where it was because I felt it being removed, and I swear to God, the nurse that removed it, even though I had her in stitches because I was saying pretty inappropriate things at the time because of the drugs that I was on. And when she was removing it, I said something, but I swear to God, she had her foot up on the bed and was just like, pulling.
There's nothing like that feeling of having drain removed. Oh my God.
Oh no, because the one they removed from my tummy,
horrible.
A load of blood had clotted up.
No,
Louise. The drain wound.
It's horrible. Honestly, every single one felt sick.
I had to have that. I had to have that suctioned out as well, and then my bags were leaking. Apologies to Hollister if anybody wears Hollister bags, but they stuck Hollister bags on me when I first come up from surgery, and I was going ballistic. I was on intensive care, and of course I've looked down and why you put them on me? I'm allergic to them. That's going to make my skin really bad. It's not going to help. Leak after leak after leak after leak, and then once the post-op once my stoma started coming to life, obviously the bag leaked. And the nurse at 4 in the morning is going, wait there, I'm just going to go and get the suction tube. And she said, we're going to try and suck up what's coming out of the stoma so we can try and get a bag back on you.
Have you noticed that whatever hospital you're in, so obviously I've had eight refashion surgeries in my ileostomy, and every time you always get a clear bag of what the hospital use, and I think it is Clinimed every time. And I ask, can't you use a Coloplast clear one? You never use your product.
Mine was Dansac, the hospital used.
Funny how each hospital has got a different, like I'm sure mine's Bournemouth Hospital, Clinimed.
I'm not sure what
but
I had my surgery in Southend, so I know it was Dansac down there.
Was it? I think Steffi said that. I think hers is Dansac, North Halland. Is it North Halland or James Cook, or the other one? No, not James Cook. The other one. They're Dansac as well. It's just interesting that each hospital has their own.
They do. Do you know which one mine was?
Is it Coloplast?
I can't remember. You know, I really.
No, you had a flat Coloplast one on, but I can't remember if yours was clear.
No, I don't think it was it?
No,
I'm sure it wasn't.
Normally they are clear. Like, was yours clear, Louise, when you had yours from surgery?
Yeah, mine was clear.
Yeah, normally they're clear, but I don't think Steve's was. Mine was.
No, but I was really surprised that I had a different stoma. I just thought they'd put the same one back, you know, and it's gonna. And when it come out, right, it just looked like one of them giant buttons, you know, the Cadbury's button. Obviously, really sort of pink. And now it's changed into this tiny little rose thing with no definite edges at all. It's just like, come on out a little bit. I have to sort of offer it some biscuits.
If anybody remembers the group chat from last week, Steve, just thank yourself lucky that after surgery that you're not a woman and that you don't have those sort of hormones, because what's happened is now happens to be lady time of whatever. My skin's now dipped back in because of the bloating, because you know you normally gain like 6 pounds in water weight during that time of the week. And it's all dipped back in.
I've had my own bloody hormones to deal with. It's ridiculous.
Well, so for those of you watching, obviously anything that we say is based on personal experience. It is in no means to scare anyone, upset anyone, put anyone off of having the surgery done. But I'll be perfectly honest with you, this has got to be the hardest surgery I've ever had done in my life. And that is called nearly dying, being on life support for 3 weeks and in hospital for nearly 4 months. This has got to be the hardest surgery I have ever had done in my life. And I'd like to think of myself as quite hardcore. I had issues down in theatre. I've been advised that unless it's life or death or pretty much cancer, that I'm not to have any more surgery done. I died down in theatre again. I come out of theatre, my lactate levels were through the roof. I was being pumped full of antibiotics because of suspected sepsis. I was also on acute renal failure watch as well. After that, I've got to go back to the GPs and the hospital and have all my bloods and everything done to monitor my liver and kidneys because of what went on. I'm not good with fentanyl. I'm not good with oxycodone via IV. The nurses at one point had to pin me down and slather me in aqueous to try and stop me from scratching, because the effects of the itching, Ben will tell you, I've still got scratch marks up my back and up my chest that have only just healed, and I've got like 4 finger marks in the back of one of my legs as well, from like where I was scratching my leg because of the opiates. Thankfully, the matron, once they moved me down onto the high dependency unit, the matron remembered me from before. I said to her, I want to come off of it, and the doctor's going, but you need it, you've had surgery, you know, it's 3 or 4 days post-op, you still need to have it. And I was like, but I don't want it, it's not doing me any good. So yeah, thankfully, matron fought my corner and got me removed off of all IV pain meds that day, and I pretty much winged the rest of my hospital stay on IV Buscopan and paracetamol with the oxycodone, but the slow release ones for the 12 hours, and not the ones they give me when they discharge me, which you take every 4 hours, because that stuff sent me absolutely batty. One thing I will do, obviously, we all have our own bags and we all have our things. All of us, well, I know I will. I've got blog posts in the lining, obviously, with regards to my recovery process. I've also got a blog post coming up with review with regards to the high output bags from Pelican. I have to admit, Rach, I've got to ask you this, because obviously
you ask your question first, I'll ask second.
You're a bit more in the know than me. Is this what you have on the bottom of your ileostomy bag? Not your ileostomy bag, your urostomy bag.
Yeah.
Because this is obviously a high output for ileostomy, but it's got a tap on it, which
smaller bung. So the bung that I use for urostomy is a smaller bung. So that one's thicker.
Yeah, because I've also half the reason why I got them is my output is ridiculous after surgery. It takes a while to settle down until I've got my food routine and everything back in place. So I've also got the night drainage bags which attach to it. I won't say that I left hospital swinging the night drainage bag around my head at all.
when I had
I thought you said swigging then. Oh dear.
No, I was swinging it. My mum's going, I can't believe you. And I'm going, blame the drugs, mum.
I don't think it's just the drugs. I think it's when you have one. So when I first had a night bag when I was 20, I used to pull it around, going, yeah, doggy, 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 and I'll just walk and pull it along, and then I'll have it above my shoulder like this, and then I have it, and I've now had a night drainage bag every night. I'm tied to the bed, not in a good way. Thanks. For the last, like, what? How old am I? 30. How old am I? 32. 20. Oh my God, 12 years. 12 years I've been tied to a bed with a night bag. I've not had free reign of the rolling around the bed. Oh my God, that's a long time. Sorry, I digress.
No, that's okay. But
when he doesn't have his TPN on for a night, for whatever reason, like, it's well weird because there's no tubes and wires and...
The only thing that I was worried about the night bag is my mum was trying to get me clips to clip it onto the side of the bed. Obviously, my mum being a carer, my mum has access to things like the night drainage bags and everything else. Not the high output bags, obviously, but my mum has access to like the catheter bags that you can put on the bottom. So my mum's got me a load. And my first night home, I could hear
the cat.
Rufio is trying to get his claws into this bag. I'm like, no, please don't get shit all over my carpet.
Apparently it's really common. So like one of the questions in the urostomy groups always make me laugh, and it's like, has anybody had problems with night bag and cats? And my mate Gary, he refuses to use the night bag now because his cat will just try and like mark it and it goes everywhere, and yeah, apparently it's quite common.
Do you know what though, Rachel? I have found those bags a lifesaver. Now, for any of you if any of you do happen to go over onto Pelican and go, oh, they're not on the website, they're not. The high output bags aren't on the website at all. If you do want them or you do need them, one, you need to speak to the stoma nurse, and two, you would actually have to ring Pelican direct to inquire with regards to them.
Because Shell messaged me about a specific situation with somebody else, and I looked at Coloplast and I was trying to find Pelican and I couldn't find them on the website.
No, they're not on the website. I know that because I have to see, they sent them out to me because I knew what I needed for hospital and coming home from hospital. I knew what I needed, so I rang up and asked, and they sent me out enough. For those of you with regards to those bags, they do them in up to a, what's the size of that one? So this one goes up to a 40 for the base plate, and then they do another one that goes up to a 60. So for those of you, if you do have a large stoma or a small stoma, then that is covered.
Can I say though, this needs to be highlighted. It's only really works if your output is literally
like water.
Because otherwise, when you attach a night bag to it, there's no way it's going to come out of the bung and the tube. It has to be like, so when I had C. diff, that was when I used it, because C. diff was awful, and it was about 6 litres more than that green water. Like when I had that, that's when I used it. But when it starts to thicker up, you can't use it. So it's only if you literally have really high output. You have a judeostomies use it as well, or you have short bowel. If it's thicker, you're going to have problems with it. So I think it's just to highlight that, because some people might try and think, oh, I can't squeeze it out. And
no, it won't, because what happened was my output started thickening back up again. It was really weird. I had another 20 centimetres of my small bowel taken out. So I thought, great, that's going to be like water for the rest of my life. It went really thick, but my hormones are playing up, so my output's gone to water again. I've already emptied my bag 8 times today, and I've got the large ones on. So I'll keep an eye on it over the next day or two. And, oh, yeah, those high output bags are not designed to wear jeans or nice clothes over the top of it, because it looks like it looks like you've got a special item in your pocket. Let's just put it that way. If you're wearing anything that's a bit too close, if that makes any sense. I think. This is if you are going to go for Barbie butt surgery, hold it off, love. Wait until you're like really, really bad before having it done. Trust me.
You're like, oh my god.
Can I mention that I was a double bagger for about 5 or 6 days?
Yeah, he was. He had a urostomy pouch on. I was like, oh my god. I had a urostomy pouch
over my wound that was opened up, and there was quite a bit of exudate. Is that the right word? Exudate was coming out. So I had 2 bags for a bit, didn't I?
Oh, you should have got a photo.
Yeah,
I think I did, but I just didn't. I wasn't in the mood to do any posts, to be honest.
To be honest, Steve probably hasn't mentioned actually how poorly he was. Like he had Louise said that she came off the IV drip. Steve was in horrific pain because he had a fluid collection. It was outputting litres and litres from his wound. Like Steve hasn't actually said how poorly he was and how worried I was and how worried the nurses were at some points. And that's why you were in so long. And I think it was really tough for you, but you don't really say how difficult.
It was tough. It was tough. I mean, there was obviously an infection there as well, which they sorted out. What made me laugh, though, is the funny things that you find about being in hospital. I mean, some of the gentlemen that were in my ward were hilarious. There was one chap next to me. Rachel loved him to bits.
Oh, I love him.
He's an old boy. And he used to go wandering about 3 o'clock in the morning and do lots of folding. He'd have all his bed off. He'd have his bed on the floor. He'd be folding it up. I can't remember his name, but let's just call him George for now. He used to say, right, George, do you want a hand with that? And he said, no, I'm fine. And he'd be folding all his stuff. He'd get it all out his bag. He'd be just up and folding. That was him. He was a folder.
That sounds crazy. He was moaning the other day. He's like proper still into his routine in hospital, but obviously because he spent so much time there, they all know him. So he's on the phone to me like last week talking about how moaning because people still had the lights on dead late and blah, blah, blah. He wants to get to sleep. And then this week he's told me that the other night there was a woman on HCA who brought him his blankets and whatnot because he has to make his bed. He's got OCD, so he's dead faffy about the bed sheet. So he makes.
I'm the same. But I have to make my bed because I like it tucked in. I'm the same.
When she rings him, it's 6 o'clock in the morning.
Hmm.
So I was like, so you had all the lights on, waking everybody up then?
I'll make you laugh. In the height of me being drugged up, I was shouting on intensive care in HDU for the first sort of 7 or 8 days. Hey Google, turn off the bedroom lights. At 11 o'clock at night.
Elsie's ward, there was a Steve, you got to tell the breakfast, the high protein breakfast.
Oh my God.
That was so funny.
What was his name now? Can you remember?
He was a farmer, but no, I can't remember his name.
He was a hilarious gentleman. He was opposite us. Now Liam, you know Liam, he was in about a month ago or something like that, probably 2 months ago. He was in the same ward as me, the same bed. This same gentleman was in the same ward. Now Liam thought he had special needs of some description, but he was fully 100% there. He used to play them at it like a good one. The nurses would come round with a high protein breakfast every day, bacon, eggs, sausage, the works, all in this little tin foil thing. And he's this one nurse, right, that he just didn't get along with. He used to cause her grief. She used to go, "Come on, Frank, it's time for your breakfast. I'm not eating that. You can't make me." She's bullying me. Used to really give it loads. And then on my birthday, which is the 28th, he said this same nurse was on. He said, she says, "Come and have your breakfast. It's high protein. I don't want it. I don't want it." She's going, "Come on, you've got to eat it. It's been prescribed for you. I'm not eating it. You can't make me." And I've shouted across the room, "I'll have it. It's my birthday today." And he's gone, "See, he wants it. Steve wants it. Give it him." And she's going, "Oh, you can have it then." I thought, piss off. I don't want it now. I did have it, and I was really full up and bloated afterwards. I was in agony all day. But the guy was hilarious.
But when you spoke to him, he knew exactly what was happening. It was so funny.
And you know what? He had a new stoma. He'd never had a stoma before. And when they used to draw the curtains, and obviously, you know, you'd hear them changing, and then you'd smell the fact that his stoma had been changed. He was really playing at it. He was more than capable of changing it and doing it all himself, but he'd sort of make excuses for not doing it. "I can't do that.
Do you know
There's no chance I can cut that."
My stoma nurse in hospital was lovely. She was Irish, and she just had that nice lilt, and you know, she'd come and sit, and she'd sit down and talk to me and eat my cakes, because my mum had bought me cakes in and food and bits and pieces, but I couldn't eat it because of the ileus. Oh man, ileus, 8 days, worst 8 days ever. There's nothing that can describe ileus at all, other than it's just not good at all. But that was half the... No, it's why I asked to come off of the opiates, because I know I had ileus, and they was threatening me with an NG tube. And Ben pulled the doctor to one side. He said, "I don't think an NG tube's a very good idea." He said,
"Well, if you've got ileus, like I've had an ileus and NG tube, and that's usually how they treat it, because you're vomiting so much, you have to have the NG tube."
Oh, Rach, I've never seen so much come out of me. They'd given me, you know, the 1 litre pans. The bowls they'd given me, and they would have like, I was swapping 1, 2, 3, 4, 5 out.
They should have really put it in, Louise, because like if it's that, normally I think Bournemouth Hospital would have put an NG tube in, because it's dangerous.
It's like kind of like you shouldn't really have given the choice, I think.
No, I don't either.
Well, in all honesty, that my doctor on the round said it's better out than in, and I was like, yeah, but I'm scaring the living daylights out of the nurses. I said, no, I know you guys won't let me go home until my stoma output is beige and of something that resembles what is meant to be coming out. I said, and it's not just bile green. But I was all right.
Did you have an epidural?
No, they gave me something else in my back. That's another story. I come round in recovery, and what they'd given me didn't work. I was screaming.
Was it rectal sheath? Was it rectal sheath?
What the original plan was, because I went in with my mum and my mum's friend, because Ben had to go for a meeting just as I was going down to theatre. So the last meeting that I went into with the anaesthetist, I took my mum and Dawn in with me, and he's going to me, "There's this thing that we can put in your back." He said, it's not an epidural. He said, but it's something. He said, at least for the first 24 hours. He said, you won't feel anything at all. down there, and we'll put a wound catheter into your abdomen, your abdomen, and we'll inject like local or whatever it is into that, like for the first couple of days, just to get you over the pain. Well, I think the thing is, because of the amount of scar tissue and the other bits that were going on, they just put, like Rachel said, they put a rectal sheath in. So that was absolutely fine from that point of view. I couldn't feel anything from that side. But from the other side of things, what they'd given me, because of the amount of time I'd spent down in theatre, it wasn't working. So they had to come up with another game plan quick. Obviously, they can't give me morphine. So they went with Oxy, but it took, Mum and Ben said that I went missing for a couple of hours before they found out that I was on intensive care. There was no contact at all, but that was because they was trying to get me stable and obviously under control, and obviously with the lactate levels, and them having to pump me through with like the potassium and the magnesium bags and everything else to bring my levels down. I think it was just a scary time. The last thing on their mind was obviously to call me Mum and Ben. It was get her under control and, you know, get her onto intensive care. So
what I'd like to say is that Steve's consultant called me, and that meant the absolute world, like the absolute world, because so Steve was in surgery for 7 hours, but I didn't see him. So he went down at 9. I didn't see him till 9. And I thought I knew where he was. He wasn't on the ward where he was supposed to. He wasn't in HDU, but I found him eventually. And they let me into the recovery room because there's no other patients there. But his consultant called me, and it was 4 o'clock, and it meant that I couldn't understand him very well, but it meant the absolute world, because it was like, wow, I've never, like, my parents have never had that with all my surgeries and the massive surgery, the bladder removal.
Yeah, because you were quite worried about that, wasn't you?
Yeah, and I was in for what, 10, 12 hours for that, and the consultant never, and he called me, and it wasn't his like minions. He called me. That meant the world. Like, if you can mention that again when you see him, because that did mean a hell of a lot. Yeah, I will.
See, I went. They gave me the option this time round. Last time when I had my stoma surgery, my colectomy in 2015. I was awake while they put the epidural in. They had a practice doctor that was doing it, and he missed about 3 times, hit the bone, but got it in eventually. And I had fantastic pain coverage. I was completely numb from kind of the chest down. Whereas this time round, they gave me the option of being asleep to have that and the catheter in, which is obviously I chose that, and but it never worked at all. So I woke up in agony with the is it the PCA?
Yeah.
And that thing, it was like my best friend for about 3 days. I was every 4.5 minutes I was pressing it like scale electric.
It's but like, don't keep pressing it. You're just resetting it. It won't work properly. You still have to wait until the bit goes white, and it's like, oh.
I did laugh because I don't know what it is. I always get stuck somewhere that has got all the oldies on. Now, this is no disrespect to the oldies, because I absolutely love them, and I actually, apologies to Sam Minton, who originally gave me Ollie, the Buttony Bear with the stoma, but I gave that to a lady on the ward because she wasn't having a great time. She'd actually had her stomach removed and things put back together, and she wasn't having a great time, so I gave her Ollie to cheer her up, and I left her with Ollie when I left. Along with the soft food that I'd taken in with me that I hadn't eaten. So I took jellies and custards in with me, and I left that with her because she was having her swallow test done again the next day because she'd failed 2. So she was going for her 3rd one, and they thought that was going to be it and that should be okay, and she was allowed back on soft food again. So I left all my custard and jellies as well.
Can I mention the bed in which I had to lie in? It's because of obviously having pen bum surgery. The mattress was an air one that kept filling up with air. Now, every time you tried to push yourself up the bed, you know, firstly I couldn't reach the buttons to bend the bed back. Pushing up the bed, it just sounded like panpipes. The thing kept emptying of air, and it literally sounded like I was doing an orchestra of music. It was hilarious.
Steve, I'll make you laugh about that airbed. I forgot about them being airbeds, and I got out of bed one night and I unplugged the plug thinking it's not a plug that was needed, and I plugged in the iPad charger and my phone charger to charge the iPad and my phone. Woke up at 3 in the morning on bed, feeling like I was sleeping on metal. Of course, I'd unplugged the air mattress. I was flat on the base of the bed.
Oh, it's horrible. I hated it. You know, the main problem I had, the most uncomfortable bit, and it might sound stupid and really not important, but it was pillars. Pillars. Trying to get a pillar comfortable behind my shoulder blades in a position where I was comfortable. I was constantly like that and not comfortable. Even when they'd come and pull me up the bed, I was constantly hunched over or.
Well, I think.
Do you remember the first night where they didn't have the airbed and they were moving you over every 4 hours? They were turning you around.
Yeah, I do. I forgot about that.
Yeah, that was the first night until they got the airbed. Because I said, you won't like, I hate the airbed. Like, we always have battles when I go into hospital. I went, I don't want the airbed. You need it. I went, no, I don't need it.
Oh, it's horrible.
I don't like the sound of the machine and the moving up and down.
I think the problem is with the airbed is the fact that it's constantly moving. So it doesn't matter what position you get yourself comfortable in. You know, in half an hour, 45 minutes, that air machine's going to go off again and it's going to start rippling the mattress back up.
Well, Rachel come down and we had a cuddle on the bed, didn't we? And the thing was making ridiculous noises. It was just woo. It's hilarious. Oh, it's funny.
I've never tried it.
I was going to say, I think I have to agree though. This operation, I think any dignity and pride I did have left, I no longer have any. I think, especially coming home, of course, I mean, Steve, you was discharged under district nurses, wasn't you?
Yeah.
So you had people coming to clean your wounds and...
You had to. It was in such a bad way. I was worried that he wasn't going to get a district nurse, but they were quite worried about him.
They only really looked at my top wound. I think one day they looked at my bottom, but my bottom's been brilliant. I mean, the second or third day, I went to the bathroom and I put one of them toilet hats, you know, the cardboard hats that you get, and I put my phone on there and I set it up, voice control, and I've squatted over it and I've shouted capture. So I've got a good picture of my butt and what it looks like, and I was really surprised, you know. I kind of thought that they'd just be stitching it from the inside. You know, like, for instance, if you were sewing two bits of fabric together, so the outside bit would be really smooth and the inside bit would have the frayed bit. Well, it had, like, on both sides. And I was really confused. I thought, it looks a bit like a Cornish pasty on the outside. What's going on here? Like, but apparently it will smooth up. And fingers crossed, everything's been fantastic with that. But they must have been listening to me outside that bathroom, going, "What's he shouting things in there for?"
Bloody all I remember is peeing in pots, sticking output in pots. Trying to wash with a central lining is not pleasant at all. Having your central line removed whilst you're lucid. It was huge. No word of a lie. It's something like that. The tube that goes down.
I was terrified when they did mine, but then I mostly just was bored because you have to lay flat, don't you, for like ages.
Well, and it's when they take the central line.
Yeah, when they take out the central line, I think you have to stay laying down and don't move.
You've got to be like, the bed has to be like head down. And it's the same with PICC lines, exactly the same. You've got to be like head down for like half an hour. And usually I'm like, oh God, look at my phone. And I've got to sit there for half an hour. That's the most hardest bit.
Well, I didn't have my phone. They'd given me that. But because you're so far back, it's actually not uncomfortable. So because I'd got so worried about them taking it out, I was actually relieved after the fact. Period of time I just had to lay there.
I think I can honestly say that Ben may never look at me the same way again after what you had to do when I come out of hospital.
I've had TPN in my central line before, and I much preferred TPN in the PICC. So when I had TPN in central line, I swear that vitamin C stuff, Natalie, there's a Steve have it now. You can taste it in your mouth. It's one of the most awful things. I hated that. Whenever they used to give me the vitamin C infusion with the TPN, but when it's in the central line, it's like even more. It feels like it's your whole of your head. Like I much prefer TPN PICC because you don't. TPN central line was just like, it wasn't very nice. Like, it's like you could feel it.
It's about tasting it.
Oh, the vitamin C, and it's this taste, and you can't get it. You can't get it out.
He had to have the vitamin C the last time he was in, when he first had his port put in, or it might have been when he went in with the infection the other month. But
sorry, Matt.
I've been on Pabrinex.
Have you? I was on, like, because I had them both, like the TPN vitamin, and that was when I was in for 3 months, and then when I was also in for one of the refashions when the stoma wouldn't work at all, and they gave it to me then. But the vitamin C, I wasn't sure if Steve gets it all the time, because I was sure it's like when you start it, or I don't know. I was prescribed it constantly, and I remember going, "Please don't prescribe it."
Oh, Steve, did they give you the Forticips to drink after surgery?
Not at all. Not at all.
You lucky git.
I used to love them. You know. I used to really like them.
I liked my ones.
I liked vanilla.
I didn't. As for drugs, I didn't get along with the codeine at all. They found I kind of like, even the only thing really I was having was morphine and Oromorph, and really that wasn't really Zoromorph and Oromorph, and that really wasn't taking away the pain. I was just smashed all the time. I just felt completely, you know, I'd find myself writing, I'm going to look at my phone and I'm going to do a post. I'm going to do one of them posts where you take a picture of your legs, or you take a picture of your cannula, yeah? You put a bit of a filter on it and you do this and you do that. And then I'd find myself sitting there for about an hour and a half just staring at Samsung, thinking, what the hell are you doing? You've no idea what's going on, have you? It's just madness.
Do you know what? If you look at my text messages or even my WhatsApps to Rachel a day or two after my surgery, I don't think they make sense at all, do they, Rach?
Oh, they managed to make some sense. Yeah, I was surprised how much you were on your phone, because Steve couldn't be on his phone for at least a week. Like, I don't know if you. That's why I was updating everybody, but they weren't too bad, Louise. I think you said one funny bit, but I can't remember what you said. I can imagine you saying it. That was quite funny.
Oh, yeah, Dope. The nurse, she was saying to me about, obviously, the Barbie butt and obviously it being closed up. And I was going, yeah, no more whoops moments anymore. I had the nurse on the floor. Apparently, it was the first time she'd ever heard that out of a woman patient.
One of my nurses also had a stoma.
Mm.
She was lovely. She's on Instagram now. I think she's got an operation to have a Barbie butt in about a week's time. Oh, she was lovely. So the nurses were fantastic.
But really she's having it in the hospital, in the ward that she works on, which must be really difficult.
Yeah, it must be.
Really difficult. You're working on that ward and you're having Barbie butt surgery.
Steve says he agrees the vitamin C stuff's the worst tasting.
Oh, does he? Yeah. It's awful, isn't it, Steve? Ugh.
Out of all the lines, his port's the best for not being able to taste so much.
I found the central line I could taste more than pick.
Steve, just out of curiosity, have they told you that you've got to go and have B12 injections?
No,
regular B12
nothing at all. I've been signed off from my district nurse because my wounds are manageable by myself. I'm literally, all I'm having now is Zoomorph, 2 tablets in the morning, 2 of the evening. Oromorph's finished. I'm literally topping it with paracetamol as and when. I've got enough Zoomorph to last me till Sunday, and to be honest, I think paracetamol will manage then. You know, it's been quite a quick turnaround. It went from really, really poorly, thinking that you know, the worst, to sort of kind of quite positive.
You see, as of tomorrow, I wouldn't think that this time 5 weeks ago, I thought my life had ended for a good couple of weeks.
I was so worried about the Barbie butt procedure. That was my main, you know, I was petrified by all the sort of, you know, the ins and outs, and it's been nothing, to be honest. That's been an absolute breeze. Where, you know, my tummy's been completely different. I don't know how I'd have coped with them both, but that one's been fantastic. You know, I know a lot of people that are going in for that, you know, that have been in for it and are going in for it now as well. So it's quite a worry to some people.
I think you notice it more. I think when you've had it done, I think you just notice more amongst the groups and people asking the questions, because you've had it done. It just seems to stand out more. It's like when you get a new car, isn't it? And you see the car that you're driving everywhere. I think it's the same like when you have different types of surgery done as well.
But I think before Steve had his surgery, and you, Louise, it seemed to be that quite a few people who had the surgery were having complications with the Barbie. And I think that was why you were concerned, wasn't it, Steve? Because I think the groups are really good for support, but also I think you don't always get around.
No, but I've been making a point. You're absolutely right, Rachel. I've been making a point of telling people how fantastic that surgery was.
Yeah, mine's healed. As far as I know, there's nothing coming out of it. There's no. I
can't wait to do the post that gets banned. Because it's coming. You know it's coming. I think that's really worthy of a ban.
Are you going to do that?
Yeah, absolutely. You know I am.
Make sure the balls are out of the way.
Steve, what was it I said? Don't. I think I did actually say to Steve.
Yeah. I know, that was good, wasn't it? That was quick.
I think I did actually say to Steve, I think via Messenger last week, that I'm going to go and get Mattel tattooed.
Yeah, that's really good, you know. But don't have it on your butt, because that's a tattoo that you want to show people. So have it on your waist, just above your butt, so that because you can't keep taking out your bum to show people.
Oh, you don't know how bad I get when I'm drunk. I'll just flash anything.
Oh, that's hilarious, Rachel. You've threw me off my stance now. I don't know what.
Because I've seen actually when the Stoma Babes and Warriors, that Amanda put that picture up, and it was but it didn't get banned. Well, but I can imagine it being quite hard for a guy, so that's why I said it.
I did a post last week, and it was three stages of scar. I don't know if you've seen it.
Oh,
it was like. With the staples, the next one, and straight away I got a post back off someone who I thought was one of the admin of CC UK saying you really should have put this in the comments, and I thought no,
group has gone to hell.
Well, I still like it, I do, and I like the fact and it didn't get banned, and he gave me a sort of warning, and then someone was like, well, hang on, what are you pretending to be admin when you're not admin? It didn't get banned. I got no warning off anyone from CC UK. All I got was support. It was brilliant.
I think the only thing that does me with that group is there's people like you that have posted up those pictures. There's nothing graphic, there's nothing obscene, there's nothing scary. People are posting stuff like that up, and they're getting bullied by other people on the group because it's too graphic. Yet somebody can post a photo with their boobs out or other bits and pieces out and their tattoos, and they get all the support in the world. Yet somebody that is generally asking for help, or generally posting, an update. Obviously, this is the realities of surgery. This is what happens, and it's just the stick that people are getting. They shouldn't be getting that.
But the thing is, when a forum gets that big, it loses. You can't really manage it. It's massive. It's massive, and there's a lot of people that get to see it. But you can't really manage it. You can't really police things. So they have to put one sort of rule as to say comments, put in comments, graphic pictures, but it's not going to be the same for every single picture that you put up there. So I sort of question that, and I love a little bit of a little bit of law breaking every now and again. Only legal stuff, of course. But that bum, I'm definitely going to do.
Well, are you going to do that actually on your profile page?
No, not on my main Facebook now.
That's what I was going to say. That's a bit too.
Well, no, you know what? I may do. I mean, you know what? It's no longer. It's like a boob. If you cover the nipple on a boob, it's no longer as sexual as if you see.
What is it? That boob reindeer jumper?
Yeah, but do you know what I mean? It's kind of like it takes away that really rude part. And I suppose it's the same with the butt, isn't it? If you get rid of the bum hole, then it's no longer it's just the cheeks, then, isn't it? I suppose.
Do you know what? I haven't even looked at it.
Watch this face.
It's a bit difficult to try and turn around and try and get a view of it in the mirror to have a look. So
do what Steve did.
Do what Steve did and put it on the floor and go capture.
You know what I might do? I might do like a cheeky sort of look around. Like a cheeky look around like that. Doing that.
Do you know what? I'm really glad that only Stoma people watch this. I hope if you've got anybody else, I'm sorry.
You know what? If I get banned, that's the reason, and you know what? It'd be worth it. It'd be worth it just for the. It'd be hilarious, and I'll post it on every single forum going.
Oh, do you know what though? Do you know what I thought? No more movie prep, no more flexi cigs, no more colonoscopies, no more bowel prep.
No.
Just in general, I will never have to be violated that end again. They'll just have to stick with a gastroscopy and a scope down the stoma. And to be honest, the scope down the stoma doesn't hurt.
Does it not?
I've never had that. I don't fancy it, to be fair.
To me, seems worse than anything else.
It's slightly uncomfortable because dependent on where they're putting it, sometimes they inflate a balloon, obviously, to keep it in. But other than that, it's not painful at all. And I never have to worry about getting the train home and having a nigh-on accident because of whatever they flashed through.
See, it's quite hard for me to accept that I've got divergent colitis the rest of my life, and I won't be able to have that surgery. And I would rather have that surgery than deal with the bloods and everything and weight loss and all that with the divergent colitis. But it is what it is. They can't do any more. They've categorically said, I'm not touching you again. Too risky. So I have to accept, you know. And I think not everybody is able to have the surgery, and it's to keep that in mind as well.
You know, we're not all.
We're not all sort of able to have it, but I'm really glad that it's worked for you both, and I hope it gives, because I know, Louise, you struggled with divergent colitis and your Crohn's, and I think, but you know, both Natalie and myself, it's a bit, you know, it's a bit difficult because we don't know. I don't know, Natalie, if you know when yours is going to be, but you're kind of at that limbo stage.
Rachel,
you know?
I think with everything that is with you medically, I think going through the operation myself, and obviously you seeing Steve go through it, I think it's better that for you, I know it's not easy, but I think it's better for you that they have said no at the current time. I know it's not a great situation, but it's a lot to put you through when you're going through what you're already going through. It's
like what they said about the surgeons, isn't it?
I think it's there's the kidney function is where it brings it into question, but it's just that afterwards, like Mr. Howell just went, I'm not doing it. He said, unless you are literally dying, I am not touching you. And I went to London last week for an award ceremony, which was brilliant. But the getting lost in Bank Station and carrying the suitcase up the stairs, my prolapse now, my prolapse is huge, and it's like some days I can go in denial about it, and other days I'm like, yeah, I've got this. It's always going to be look like a willy. I've always got this prolapse, and actually, someday, and now I'm starting to think it's never going to go. And so most of the time, I'm okay with it. But when it's really like now, it's hurting a lot, and it's like, oh, I go through stages of being complete now, and then I think I don't honour my health, which is always the thing. But I need to try and balance it better. But you know, it is what it is, and I'm sure tomorrow I'll forget that the prolapse is there, and it's okay. It's just it was triggered by last week, I think, carrying the suitcase.
Rachel,
you've got bands and you've got like boxes that go over, and it's fantastic. They work brilliantly, but half the time, Rach, you kind of forget to put them on and stuff, don't you? And then you suffer from.
No, I only wear the boxes when I go out. I don't wear them around the house because it although it flattens it can hurt it.
Yeah, but you know, you've done a fair bit of travelling over this last year, haven't you? So you've got to kind of like honour that. I mean, you are, like you said, you are in denial a lot of the time, which is, I kind of think, you know, you've done that much travelling this year and nothing before then, really, was there?
You know, Rachel, you've got to think though as well, lovely. You've got to think. I know it's not all great, but you've got to think the amount of people that you help. Because you're living with what you're living with and what you're going through, the amount of people that you're helping is commendable. It really is absolutely astonishing. You are one unique human being, lady.
I don't know what to say. You could say the same about all of us, but I think we all do this because we've been there. We've been lost, isolated. You know, I'm just doing my speech for Monday and saying that how I never knew there was a support network. How could I have a catheter since I was 20 years old and not meet other people with catheters and not have a support network? And like Natalie, you said that when you were in hospital, there was a young guy with a catheter. Steffi's just had a young guy with a catheter. No support, no identification, no groups. Why? Because urology, we are far behind colorectal, and this needs to change. And I'm hoping that if we can start it, because we are so far behind. I had a meeting with the director at Bournemouth Hospital today, and we've discussed, and urology, they're trying to push the patient engagement more. Why is urology so far behind? There aren't as many advocates, and it's like smashing the head against the wall sometimes. Sorry, it's my little rant.
You're doing everything in your power to make that to change, aren't you?
Yeah, but I don't know why there's so much resistance. I don't know if it's because the diagnoses aren't clear cut, like Crohn's colitis, IBD, bowel cancer. They aren't as clear cut in bladder.
They're not.
I actually asked Ben's sister about this because obviously she's a nurse, and I said to her, like, obviously the companies and people trying to get the figures as to what's being done and everything else that's being done, and she said it is a minefield. She said trying to get the correct figures. She said because of data protection, and she said and because of how, you know, you think of it as a urostomy, but then on the other side of things, other people are calling it an EO conduit and not a urostomy. And she said if they're not asking for the right figures, she said, or they're not asking for that for those specifics, she said it's really, really difficult. She said because it's classed as different things under different surgeons and different teams. She said that's why any of the figures that we all try and get are never gonna be 100% correct. But you are right with regards to the catheters and everything else. There isn't.
I've questioned today whether we start up a urology support group in Bournemouth Hospital, and whether that's gonna. And I know I'm probably committing myself to more stuff, and I know Steve's probably shaking his head, but I don't care, because it's like people shouldn't be left by themselves, because if I had support, I probably would have been less mental than I was, and I wouldn't have done what I had to do to cope and all that stuff. And
I think that's something you could set up and then choose admins rather than you be...
No, not a Facebook group, an actual physical in Bournemouth Hospital with a specialist nurse present every meeting once a month. Or every 2 months.
That might be a really good idea, because I know that's really close to your heart, you know.
Well, because Neil said, how can we get more patient engagement? And I just went, we need to support group, like a urology support groups, and maybe that will help unite and then help improve things. And possibly like around interstitial stuff, catheterizing, prostate cancer, all the urology, nephrostomies, kidneys, there's so much. Maybe that will help, having like a physical urology meeting, because they got Cupid here, but there isn't anything kind of urology based. There's prostate cancer groups, but there isn't anything for people that are long-term catheters that are lost. You know, self catheters some have a good care system. Sorry, I know I'm going on my little rant. No,
you're absolutely fine. At the end, you know, it doesn't matter if we overrun. If we overrun, we overrun. It's
I've got to go. Love Island.
Oh my god, I forgot about that.
Do you know what? I've been watching Alaskan Bush People. I've watched from series 1 to series 8.
What is it? Isn't it?
What is it?
Alaskan Bush People. Honest to God, it's one of most of these out of world things I've ever watched. It is
that there's people like that still in the world.
I'm watching Vikings.
Oh, my dad loves that show.
It was my dad that got Steve onto it.
It's brilliant. I love it.
The fact that Steve's watched it, but he keeps moaning because none of us will.
Oh, it's brilliant. The first 2 episodes, the hardest ones, and then get to know the characters. It's brilliant. It's brilliant. Absolutely awesome.
I think the women are quite good in that. I like their hair. I want
the whole thing. Yeah,
women are quite cool.
Yeah.
I'm watching Salem at the minute on Netflix. I'm quite.
Are you?
Mm-hmm.
We have hit the 9:05. It is.
It's all right. There's been a couple of comments on Face Group. There's one in Making Ostomies Call, one for Steve saying that you've actually pretty much made Eleanor's day with regards to the capture, take a photo of your butt comment. And she's now got visions in her head of both of us standing in front of a mirror and trying to get our heads around to actually see it.
My mates come up. And I showed them. I can't, you know, it's one of them, innit? You know, I'm not. I think when you go through these sort of issues that we go through, you lose all that sort of worried, you know, about someone seeing your parts. You think, just have a look, go on, there it is, flash it out the window.
Can I just say that Graham has said that? Oh no, the wrong one. Graham said that I always feel alone when I have a catheter in, which highlights my whole that there isn't as much support.
Oh, I hated it.
Graham also surprisingly is watching Celebrity Jungle.
Oh, that doesn't surprise me.
Oh yeah, I've been trying to catch up because I've missed a few.
And Steve says he loves it, Louise. He watches all them kind of programs.
I know. I'm just trying to type out a reply.
Do you know what? I've really enjoyed tonight. It's nice being on.
It's been nice, isn't it?
Mm.
Yeah, it's good to see you guys again anyway as well.
It's lovely to see you all. Oh, just to add, Steve, what are you doing for your grant for Purple Wings? What
mine is a night away in a log cabin. I can't
Heron's Retreat.
Heron's Retreat, yeah, log cabin with a hot tub. So it's just really about me booking
like a cabin type place.
Yeah,
isn't it?
yeah.
I got a spot.
Paige come up to me in hospital when it was really nice.
Oh yeah, Lauren did say to me about hospital, but I wasn't in the right frame of mind and I wasn't being very nice to people whilst I was in hospital. Ben said I had a couple of paddies, pretty big paddies on that night. I did when I come home as well, apparently. I don't remember, or if I do.
When she came to see me, she literally came like 4 days after her op, and she brought Tracy with her, another lady, and a little one. And I was sat there feeding them Milky Way stars or something.
Oh.
But no, it's lovely.
Oh, I don't think I've told anybody. I won a spa day for 15 people. I went to a mental health coffee morning because one of the women I know that lives near me was running it, and she's an advocate for it, and she herself has got Crohn's disease. Funny enough, we near enough crossed paths up at Pembury Hospital today. I was coming out, she was going in. And I put £20 into the raffle for tickets because obviously it's all going to like the mental health charities for like the advocate and everything else. And I won a spa night for 15 people. Do you think I can think of 15 people to take? I'm really struggling, and everyone's fighting because everyone wants to go, and then the girls are saying, well, the men shouldn't be going because it's not a man thing, and I'm like, well, the men can go if they want to go, you know.
And then you babysitters because everybody you know is going with you.
If they really love me, they can kiss my now non-existent butt to go.
Right, I better go.
Yes, I need to go.
We better go.
Right.
Nice to see you all.
We will be back next week. Natalie, I remember you saying, what are we discussing next week?
I thought we were going to do the complaining and changing your care and private care and stuff like that. I'm not going to be on, but we're going to have Steffi will be back. No, she won't. Steffi's off.
And I might not be on because I might be in London because I might be doing a BBC Ouch podcast. But I'm not sure yet. So I'm unsure yet. So I might be on.
We've got a guest lines.
It's just gonna be me, and I'm gonna be doing a dance.
No, I'm on as well, Steve.
We could both do a dance.
I found out the thing I'm doing is at 7, so I might not be back for the start of the show, but I might be able to just pop on.
Okay, no, that's absolutely fine. I'll message Graham for next week because I know he didn't have a great time in hospital. I do actually have all the booklets and everything here as well with regards to PALS and liaison services and step by step of making a complaint whilst you're in hospital. So I'll post those up on the page.
And I'll make sure I post on the Facebook page about my experiences with PALS. They were to do with Riley and his care. First at Southend and paediatric urology, and then at urology at Great Ormond Street. But both my experiences with PALS were brilliant. So I'll make sure I post them if I can't make the show.
Okay, no, that's fine. I'll post up the leaflets and that next week, like the insides and out of them to be used. But I think we're all going to say goodnight because we're all getting a bit past it. We're all excited and we're all over talk and everything else. And I'm like, God, it's past 9 o'clock. So I will post about the high output bag on my personal Facebook page, my Crohn's Fighting One. There will be a blog post and a vlog coming out about that soon. Steve, good luck for going back driving. Check with your insurance company because I was allowed to go back a week early because I was off of pain meds.
So, thank you very much. Yeah,
we will say goodnight.
Stephen gonna check with insurance company. He's just gonna go in his car and drive. It's Steve.
You know,
he's got to check with insurance company, Louise.
I will put a book in front of
he's a rebel. He ain't going to check.
Well, no, because if he has an accident or some dinlo crashes into him and they find out...
Listen to Louise.
If Steve has an accident, how dare you?
No, not you. I said if some dinlo crashes into you is what I said. if you've not declared to the insurance company that you had abdominal surgery, it invalidates your entire insurance.
Of course, but my main issue really is that I don't really want to be driving while I'm taking morphine.
Don't.
It's really, at the moment, it's a real struggle. I'm getting cabin fever. I'm walking everywhere. And I don't know if you've noticed, ladies, but it's really getting quite cold.
Oh, yeah, especially I know how cold it is.
Birmingham is really chilly. And when you've got a car outside with half a tank of gas in it, yeah, because that's what we say in Birmingham. We call it gas. It's hard just to walk everywhere, or taxis, you know. So we'll see. We you know, we'll obviously think of health and safety first, because that's what life's all about. And don't you look at me like that, you. Anyway, listen, I'm going to kick this off, right? So see you all next week or the week after.
Hope you
have a lovely time.
I love you all. I have missed you all. It's nice to be back, even if it was only for an hour. But the codeine has dropped, so I'm going, because that's when I start getting approached.
See you later.
So we say night.
Night.
Have a beautiful time.
Bye, guys.
Bye-bye.